Everyone present here today has a role to play. So we are all, people with a specific assignment and no spectators as such. And this event is, I would say, a small event, but with a specific purpose. And to give you a brief rundown, to walk you through how this came about, I would like to quote that they say, the eyes doesn't see what the mind doesn't know. So to put it in another word, the eyes see what the mind knows. So on that line, our Dr. Bernice, from the Joint Director from the Targeted Intervention Division, has seen the need based on our statistics that we receive on a regular basis. So she saw the increasing trend of our young people, especially in the age group of 15 to 24. So amongst the HRG, which is HRG is high risk group. So she has been seeing this trend, and not just the increasing number of the this category of people, but also in the positivity rate of HIV. So therefore, she conceptualized an idea and initiated in a form of a proposal to NACO. Now this innovation was taken in a very positive note. NACO was positive, very positive about it, and therefore this is how it came about. And from the day one, I've personally seen the kind of zeal, zest on with Dr. Bernice. She had from the minor details to the big issues, she has been working with full of enthusiasm. So today we have this, I would say this is a very happening place today here. So in the days to come, we precisely look forward to that, for this to become a happening place. And what more appropriate coin of phrase to take other than the city barn. CT is an acronym for the Catch Them Young. So in our society, what is better than to catch them young, especially at the adolescent stage of their life? So, so we look forward to this place giving services to the needy, especially in that age group, in the days to come.
In a very exciting journey that we have anticipated, considering what our project director has highlighted, concerns regarding the prevalence amongst the young that we are seeing, and not only in our high-risk group, we are also seeing this prevalence increase amongst this age group, even in our program data, that is the HIV testing centers. And through that, we are also able to see that besides the high-risk group that we are catering to, we are seeing, an increasing trend of HIV positivity amongst young people in the state. And that is a concern where the existing programs does not have, an existing program to cover that population. So we try to conceive an innovation as to how to make a center very accessible, how to make a center very youth-friendly, and then how to make the center, comprehensive. So that's how this idea came to us last year, and then we started working on the idea of conceiving this center called the City Barn. And we also branded this project City Barn, and this came out, like I was narrating to our colleagues here, that one fine morning over the dining morning around 5, I was just sitting on the table and thinking, what should we name it? How do we make it less stigmatizing? How do we make it less HIV, thing attached to it? How do we make it, very enabling for everyone, including our own children, to come and access, okay? And that's how, like, the idea of, like, catch them young, burn is be aware, reach on time, no to unsafe behavior. So under the unsafe behavior, we talk about no to HIV, no to addiction, no to mental health, no to sexual other reproductive, problems, So this is how, like, the no will stand for no to drugs, no to HIV, no to other sexual unsafe behaviors. That's how this idea of city burn came about. And then we also had an equally exciting team at NSEX who had, helped us in molding and, creating this journey through and molding the, project plans through. So we have a very supportive project director with us who had helped, encouraged us to go ahead with the plans that we feel will be, very valuable to young people. So the idea of this center, this was put up as a proposal to NACO, and in Delhi also, and innovations are, sometimes taken up, and innovation has to be evidence-driven also. And that's the reason, we had also, submitted and then presented our presentation based on evidence that we were seeing in the state, and accordingly, this was approved as an innovation package for us. We are very grateful to our additional secretary and the director general NACO, headed none other than our own Naga, Madam Hekali Timomi. So she's also very supportive. We also have the Deputy Director General of Prevention Division who actually runs through the program needs and requirements, Dr. Shobini. So they have been very supportive to us, and then this innovation has been approved and given to the state. So the sole purpose of this center is that this center will cater to all young people below 24 who feels that they are worried and concerned about their health. And that's where the participation, we have also requested the schools and colleges around to participate and actively be a part of this City Park project. So that in schools, like young people below 24, it's not only about concerns about HIV, it will be concerns about mental health, concerns about drug addiction, concerns about tobacco addiction, concerns about your mental health means young people, adolescents, they travel through the different type of journeys. And then concerns about the sexual health, So that's the reason, we wanted this center to have professional team. We have these 3 members who will be running the center.
Who is also the ambassador for anti-drug campaign Zumbegoto. So thank you so much for your presence. I would like to give her time to speak.
A team of many, and today my sister Asna and I, we are presenting here. So on behalf of the Red Warriors, I would like to extend my heartiest gratitude to the NSEX team for inviting us in this momentous launching of the City Barn, a pioneering initiative that promises to be a game changer. I am thrilled to learn about this innovative project and its potential to impact lives. As I stand here before you today, I want to emphasize the importance of prioritizing our mental health and well-being. The struggles are real, and addictions can affect anyone. But there's hope. City Barn offers a safe space to seek help, support, and guidance. I encourage all youth of age 24 and below to take full advantage of these services available in multiple locations here in our state, Kohima, Dimapur, Boka, and Tuinsang. So don't suffer in silence. Don't suffer in silence. Come forward and let's break the stigma surrounding mental health. In conclusion, let us embrace City Barn as a beacon of hope and a stepping stone towards a healthier and happier Nagaland. Thank you.
Thank you for the presentations, and my appreciations to the Red Warriors, Mr. Kedato from the Guardian Angels. Definitely a place of convenience like this will surely promote and encourage people to come forward with much more confidence we still do not really know in so much detail of why things happen, why there is risky behavior, why we do not value our own physical and mental bodies and beings, and why we are unable to identify what is risky and dangerous. It's a learning process, and I'm reminded of the fact that the educational system in our state today, living out the country, I can recall now that our educational system does not transmit core values. I have never really been told in school, anywhere, what the core values of the society from which I come from. I do hear from the elders that, in the olden days we did not require to lock our houses. It was unthinkable for any person to enter a house. All you had to do was put a wooden beam across the door on a hook, and that was it. And I remember people saying that if you are in the jungle and you find something, for example, mushrooms, then you would just tie a bundle of leaves and put it near, and you know that somebody has found it, and it belongs to them, you don't touch. I myself have seen many of this, and we do not venture to touch. But the core values of hard work, sincerity, honesty, were never transmitted in our syllabus. We were never taught to imbibe them. Today's educational system does not really encourage you to have values and standards. And we do not really get into the nitty-gritty of things. We don't try to assess, evaluate, and understand the fact that much of risky behavior begins at home. When your parents do not have the emotional support for you, when there is lack of adequate encouragement, when parents are unable to support you emotionally, when you are passing through difficult times, when they fail to participate actively in helping you face the challenges of life. You could have a perfect home, but you are most likely to face very challenging situations at school. And I have 5 children. Much of the problems they have are at school, not at home. And in many cases they are reluctant to come back home and share the problems they experience in school. So my personal request is, in this kind of facilities, it's not so much about extending help and comfort. You also need to start documenting your knowledge, which you will gain from your interactions with people in the community. You need to build up a body of knowledge that you can share, that you can pass on, and that will become a knowledge base for you to design protocols, to design systems, to design methods, so that the knowledge you acquire over a period of years, many years, interacting with so many people is not allowed to go waste. How many times should we reinvent the wheel? We keep on doing things over and over again because our society does not have a well-structured system of passing on knowledge that used to be there in the modern system. I have spent many nights in my village sitting over bonfires with the village elders. I am now 60, going to be 60. And I have learned many interesting things from them. This system does not exist anymore. Our children do not socialize. They come home, lock up, stay indoors, and then they're online. And there are a lot of young tigers who write powerful and threatening stuff on the internet, on WhatsApp. And I remember the grumbling of an old gentle
warriors, the Red Ribbon Club nodal officers who are here, representative from Bharat Scout and Guides, the partner NGOs, to disseminate about this city barn to the young people when we go back, so that the very purpose is served.
This is the NGCC campaign, not to love ways. So any young people